And then he thought it was ulcers, put me on medicine. And I remember going in and he's like, I think I figured out what it is. I'm like, oh, thank you. I'm so glad. What is it? He's like, I think you're bulimic. I'm like, and I think you're a moron. Like, I'm in your office begging you to figure out what's wrong with me. Yeah. And your answer is I'm making myself vomit. Like, no. Or I think a lot of people, I'm very hard-headed and strong-willed, and I think it's like the cholericness in me, and I'm not okay with that answer. I'm like, this is not in my head. Like, something is seriously wrong with me. It hurts to move. My insides feel like they're trying to come out of me, and I can't keep any food down. I'm trying all these crazy diets, and it just, like, I was just so angry. And I think a lot of people are like, well, if the doctor says I'm bulimic, maybe I am. Like, maybe it's all in my head. And it's like, no, you're not. Like, it's not in your head. Like, you do have pain. And then flying home and getting tests done, within a week, they figured out, okay, you have GERD, you have IBS, you have Barrett's esophagus, you have esophagitis. Like, there was diagnosis, but then my body was used to just evacuating food. So I had to, like, literally wait for the meds to kick in and hold myself down as my body, like, was trying to just get rid of all the food. And it was, yeah, only God's grace that got me through it. So I don't know how people that suffer from chronic illness, I don't know how they function without God's grace. Like, you need to rely on him. Like, he is my strength, right?
So how old were you? 23? Is this kind of around there?
No, this was when I was like 19, 20. This is before we met. Yeah, my second year on net.
Because, I mean, you've had health issues ever since we met, and they've sort of revealed themselves differently. So I think one of the frustrations is this the same thing? Is it a multitude of things? Because when we met, what was the primary thing? Endometriosis is what we said, I guess. And GERD, we'd probably say that.
Yeah, I think we would say both. And we knew I had horrible GI stuff.
No, but that's really important too. I love what you said there, because I'm sure there's a lot of people who are dealing with chronic pain and they get given a pat answer just to kind of shut you up maybe, or just to... We all like simple narratives that make complex things easy to grasp, but I love that you trusted your body, you know, and you're like, no, that's not it. I'm not going to go on the pill. That's a Band-Aid. I'm not bulimic. You're an idiot.
Yeah, I did unfortunately go on the pill for many years, but eventually, once I did my own research, I'm like, I'm right that this is a Band-Aid.
And just pause there too, because it's not like we were intimate at this time.
No, I wasn't sexually active at all. No, this is pre-marriage, sex.
So just for those at home who are wondering, can you be on the pill for medical reasons?
Yeah.
The answer is yes. It's not immoral to be on the pill for medical reasons, and yet there's no really good reason to be on the pill, and there's a lot of reasons to not be on it.
Yeah, no, there are so many other things that you can do. So low dose naltrexone is huge. I love that drug. It's when we were in Ireland, I don't know if you remember when I was actually I had already had Liam. And it was in between my pregnancy. I met Dr. Phil Boyle at a conference in Dublin, and he's the one that told me about low dose naltrexone.
Wow, I didn't realize that.
And it helps with pain. It helps with it. So basically, when you're pregnant with endometriosis or a lot of these female health issues, it lays dormant when you're pregnant. And normally people feel great when they're pregnant. I was still really sick. So hindsight, I've had doctors that are like, you also have this, like all these other health issues, female related. The low dose naltrexone makes your body think that you're pregnant, but it's safe to be on even when you're breastfeeding. So it makes the tissue, it makes your body think that you're not pregnant, but kind of the hormones. And so everything lays dormant. So it buys you time, because with endometriosis, the joke is get pregnant, stay pregnant, have a hysterectomy. Like, it's not fun. It's not what you want. But I think the best thing is doing like a NAPRO protocol and having laparoscopies. Like, there's surgeries now that can help. So that was the main stuff in the beginning.
Thanks so much for watching. Please like if you liked, and if you loved, subscribe.